Hey, Dr. Lindsey here. I wanted to introduce this video. This guy was one of the coolest patients we've had in years. And he rolled in here with a common problem that we deal with. He's had 2 strip cases done elsewhere. The scars aren't bad, but they're nowhere near parallel. They crisscross each other. Then he went back to the same guy who does a lot of FUE. And this fella has really thick, coarse hair with big, healthy roots. Yet, despite that, his FUE yielded almost 0 growth. And so he's got a sparse hairline. He's had 2 strip cases and an FUE. He's paid a lot of money. And although he doesn't look bad, he had hair sprinkled all over his head. And a little bit of hair all over too much surface area it just doesn't solve any problems. So he's got a limited amount of donor hair now, and we'll take a strip out, get one of his old scars, get some of his FUE punch sites, and get as many grafts as we can get, and really pack that first 3/4 of an inch so that in a year and a half, he has really dense hair along his hairline. Now some of you might say, well, what are you going to do about his crown? Well, as I've discussed in other videos, the crown is a black hole that sucks up tons of hair. And even if this guy just wanted to do only his crown, he probably doesn't have enough hair in his whole donor region to perfectly fix his crown. He's wasted some hair, some of it hadn't grown. He's probably a class 6 hair loss to begin with. So we'll do the front, and any remaining hairs that we get out of the strip, we'll do the anterior portion of his crown. And as it turned out, after the case was over, I mean, his scalp really closed quite easy. It was tight before. I had him do a couple weeks of scalp stretching exercises, and it was easy to get his head closed. So although he's a 65-year-old guy, and by the time this grows in, he'll be almost 67, he's really active. He's got a young fiance. I think he's probably done. Although if he comes back in 2 years, there's certainly, it would be easy to get another 1,500–1,600 grafts without any trouble. Is that worth doing? It's the goal, it's the return he would get from going through the surgery and or wealth transfer to me, worth improving his crown at age 67? I doubt it. If he was 37, absolutely. So take a look at this guy's video, and I started with a few pictures of him, and then we get to intra-op pictures, intra-op videos. Thanks.
Which hairline is it here?
Yeah, right there. Okay, so this video goes along with the pictures that I'm showing, and this guy is a 65-year-old healthy Middle Eastern guy with a really thick, coarse gray hair, which is easy to work with. And our plan is to irregularize his hairline and pack that first 3/4 of an inch, because it was just too thin. We're not trying to make him look unnaturally young, but we took a little strip out of him, excised one of his old scars from previous work elsewhere, and did a 3-layer trichophytic closure. And then with these kind of cases, we trim down the hair in the recipient area. Let me try to tilt so I can get a little bit better view. Up to about 1/4 of an inch, or sorry, to about a 1/2 an inch long, and then I use fancy magnifying glasses so that I can make the holes as tight as I can up to and beside the hairs that he's already paid for elsewhere, and I do my best not to hit any of those roots, and then we start putting grafts in. And these cases typically turn out really good, but it takes a little longer because there's scar tissue from previous surgery elsewhere. And so rather than 13 months being the final result, it's probably like 15 months. And he lives close by, so hopefully we'll get some pictures of him as he grows in. Now, as I talked with him, and as you viewers look at, we trimmed his hair down, and when he's putting hair in the slits just adjacent to the hairs he's got, a week from now, assuming he does get it clean, it'll be a nice dense little crew cut here. We didn't trim the hair in the center of his head, but a month from now, the hairs we're putting into there are going to fall out, and he's going to have some shot cloths just in the recipient area. But luckily, you know, we're not working in the center of his head, so he'll be able to style his hair and look not unnatural. And then about 2 months from now, these couple of hundred grafts that or hairs that he's currently got in this area will come back, and about 5 months from now, the new stuff will start. And so we're just irregularizing, packing his hairline, and getting rid of one of these scars. And then we've got, assuming we have enough hair, we got a small area in his crown we're going to bolster too. So while we were doing this video, Wendy wanted me to emphasize the sprinkling of hair over a large surface area really doesn't solve any problems. And we end up dealing with this all the time, particularly on, well, it has no real age group. I mean, people go to a lot of hair transplant offices who have a salesperson who tell them, we'll put a little hair all over your head, and then you won't really notice that you have any downtime, and it'll thicken up your hair, and then you won't have to worry anymore. But what happens is you sprinkle a little bit all over, the other hair goes away, the native hair goes away, and then you look like a chia pet, or you just don't have enough hair. So Wendy, say what you were going to say.
Well, what I was going to say is that, like with this guy, there's no definition of his hairline. It was just hair everywhere, but a very, very thin. So when I was talking to him during the case, it's like he'll be able to see his hairline defined, because he did not had no definition. Like there was no definition here. It was just like little hair all over, and it looked like a bald guy, even though after he had.
And the only reason he looked halfway decent is because he has really thick, coarse, bushy hair.
Yeah, and if he had thin
hair like you or me, it would not be the same.
Yeah,
it looked like a spider web.
Yeah, so that's right, because you know they asked me questions while we're doing the hair transplant. It's like, you know, it didn't work on the other places. It might have, but they don't. I don't think they have a plan.
They have a plan to extract wealth from the patient and put it in their pocket, not solve a long-term problem.
Yeah. Well, I like how you like to plan for the future, and I think people when they want to go for a hair transplant, they say, I'm thinning, so they think that they're going to do what's right for them, but all they do is put in the hair where they need it there, but they're not thinking about the future when they lose all their hair, and then they have
and it burns my biscuit when they hear my spiel, go get that done, and then they come back and say that I was right. And you sit here and talk. I'm going to go get that guy's sheet. So talk to the camera for a second.
Talk to the camera. I remember one guy, he came 6 months later to show us what he went and did somewhere else. He had a consultation with us first, but then he went and had it somewhere else. And then 6 months later, he comes and shows me what he did. Do you think it worked? And, oh yeah, you get your certificate.
Yeah, and so one of these guys came in, and I told him he needs 1,500 in the front, and I think he went and had 1,500 all over his whole head, and it didn't work. So he brought me this back. This is a picture of me a few years ago. But, you know, it really burns my biscuit when I'm trying to plan for the future, and somebody wants immediate gratification. I completely understand it, but it's your head, for heaven's sakes. And while you can steal more money, this is a finite resource. Spend it frugally.
What does your certificate say? You were right.
That's right. Okay, so the front's done, and we've packed it in really nice. I'll try to zoom in. So what will happen is these will grow for a month, and then they'll fall out, and then there'll be some shock loss of the pre-existing couple hundred hairs that he had. And then in about a month after that, the pre-existing hairs will come back, and then the new stuff will start in about 4 or 5 months. So 13 or 14 months from now, this should really look quite good. And the front hairline's irregularized. It's no longer sparse in a straight line. So it should look really natural. And he's got thick, coarse, gray, bushy hairs. This should turn out great. So I hope you enjoyed that video. We ended up getting, I think, 1,988 grafts out of him. We put 16 or 1,700 of them in the front, so not a whole lot in the back. He was super easy to work on. He's got thick, coarse hair. My guess is this will turn out great. And assuming he does cleaning, because where he went before, they were not big on cleaning. And if you're a frequent watcher of my videos, you know cleaning is critical to keep crust from building up and pulling out hair. So he lives close by. We'll try to put up some updated videos periodically to go along with this. Thanks.